I've gone for a cycle ride. Many of you will probably recognise where I am. I'm in Kensington Gardens. The monument behind me is called the Albert Memorial. You can see a sort of gold figure with his back to the camera. That's Prince Albert. So this is just a lovely opportunity to go for a cycle. It's kind of sunny, as you can see, but also it's Wednesday the 13th of May. It's the first day that it's sort of been officially sanctioned that you can go out and have as much unlimited exercise as you like. And certainly here, there's loads of people out and about, jogging, walking their dogs, walking with friends, cycling, doing it all very sensibly and properly, staying apart where they need to, and a lot of people were looking just really happy that in some small way some sort of progress has been made towards having a bit more liberty. I've just come here obviously for a cycle ride, but I actually happen to work one day a week in the Royal College of Art, which is just next door to this memorial, so it's a place which is sort of close to my heart, a place where I've had many a lunchtime coffee hanging around here. The thing is, I think this is actually quite interesting, a memorial, because I think we've gone through quite a traumatic kind of national experience. Obviously this is a global experience, but here in the UK, sadly, we've probably had quite a badly managed experience of the pandemic. And that's meant that so far more than 30,000 people have died. A lot of people have potentially lost their jobs, and it looks like it's quite frankly going to get worse. And one day when this is all over, it will be appropriate to build a kind of monument to remember what's happened. Now, the reason I'm discussing this here is because this one, the Albert Memorial, which is huge and it has a kind of religious peak to it. It also has this base layer, which you can see behind me with all these figures, and it's quite a curious thing. I would definitely, if you ever get an opportunity, recommend coming over here and inspecting it a bit closely. And effectively, these are your kind of great figures of the arts and humanities and science. And this corner here, just to on the corner of the screen, is as the architects. So there you have Wren and Pugin and Chambers and Scott and these other people, but they're all men, which is obviously a reflection of the time that it was made, but also they're all kind of gentlemen or these sort of upper and middle class figures, and it kind of immortalises them, and then it obviously immortalises Prince Albert among them, and also, as you can see, bigger and golder than the rest of them. So it's definitely a kind of there's a gesture there, and I think if anything is created to remember this, there's two important gestures. The first thing is to remember the people who really ran towards the danger and fought this disease with their professional skill as doctors, nurses, carers, and also all the support staff that make hospitals and other places work, care homes, etc. But also the people who died themselves, and obviously a lot of those people sadly will be people working in the healthcare field, but they're also, as we're discovering more and more, they are people who are in low paid work, and it's seeming more and more like you're more likely to die from this disease, catch this disease and die from it, if you're in low paid work, and that's horrific. And really, it's bad enough that low paid work exists. We shouldn't be having low paid work. It's totally unnecessary, and it does not help anything in the economy, it doesn't help any business, it's not an efficient way of running anything, but also it has this added horrific injustice, which is that people are obviously already were suffering shorter lifespans, more ill health, more risk of disability, but also now quite clearly the added risk of being struck down in the most terrible way. This is wrong, and any kind of memorial has to remember these people and also remember the lives that they lived, and what perhaps, if it's appropriate, there could be some mention of the sort of work they did and the sort of important things they did in society and how badly paid they were for it, so future generations can look back and say, you know what, you're never going to have you should never return to that, where people doing the most important things, doing the most to help others, are paid the least, and throughout their lives are taking the most risk, and especially at this extraordinary moment with this pandemic and outbreak. So that's my thoughts, and maybe it should be on a scale as grand as this. It should have some gold or some kind of some big grand civic ambitions, and it should make a difference, and it should be something that people remember. But I would recommend, if you get a chance, get out, get some exercise if you can. Come and enjoy the sort of civic spaces in your city, and seeing other people being happy, but also reflect on this, because obviously it's something we'll think more and more about in the weeks and months and years to come. We'll keep on exploring. Hello everyone, good evening. My name's Merlin Fulcher. Welcome to the show. It's Thursday the 14th of May. It's actually the day after I recorded that introduction. But it's a Thursday, so we've just had the clap for carers, everybody out standing in front of their homes, clapping, showing their appreciation for the NHS, care workers, everybody making a magnificent effort right now. And like when you see things like this, obviously it reminds you that we're living through a time of enormous change. Things are changing, and the way people see the world and the things that people value in the world and the people who are really important, we're rethinking that massively. And I think I was going to come back to that topic of memorials. And I know memorials, sometimes it's a controversial thing. Not everybody's a big fan of memorials. Not everybody thinks we need more of them. But I think there's really two kinds. There's some which basically try to keep things the same at a time when there's a lot of change. And there's others which basically say change needs to happen. And I've been thinking more about the Albert Memorial, because really the kind of imagery there with Prince Albert, but also with all those people around the base of it, those kind of white, aristocratic white men, effectively, it kind of overlooked the fact that in the 19th century, really, actually a lot of change was being driven by other people. So it wasn't just the middle classes, it was also the working classes, it was also women, it was also people of colours. And effectively, in that monument, these are the same people who are pushed to the fringes, the kind of fantastic fringes, and they're basically ornamental, and it's just totally denying those people any kind of agency. But this effectively is a monument which is trying to, in my view, sort of resist change, and it's trying to establish a kind of order which it thinks is the way things should be. And I think if anything should come from this crisis in terms of a lasting built environment legacy, it needs to be a kind of memorial that celebrates and also demands change. And we are going to live through massive change. And so I had a look, and there's quite an interesting example of what I think is not so great a memorial, and it relates to actually a disease in the United Kingdom called VCJD, and that was described in the press at the time as mad cow disease, and people died from this disease, and a memorial was made to them, and here's a picture of it, and it's a tiny plaque, and it's on the south bank of the River Thames. It's just outside St Thomas's Hospital, which is a specialist hospital, which was the first place people with coronavirus were treated in the UK. It's also where people with VCJD, also known as human BSE, were treated. And this monument, I think it's quite a powerful monument, because although you can't see in this photo, this monument looks directly across the river to the Houses of Parliament. And so it does sort of put pressure on politicians, and it effectively is saying, never again, never should something like this lead to unnecessary deaths. So I think there's a bit of activism in there, but I think in a way it's quite sad in that it just sort of says, in loving memory of the victims. It doesn't get into too much detail of who the victims are or how many there were. And I think possibly a better example for dealing with something like this is a very famous memorial is in Washington DC, and is the Vietnam Veterans Memorial. And this was a result of a design competition. It was won by landscape architect Mia Lin, and she was quite young at the time. This was built in, I think, 1982, and it has the names of about 52,000 US servicemen who died fighting this war that was very controversial. But also this memorial itself. Now today this memorial is recognised as being one of the greatest pieces of American architecture. But at the time it was also controversial, and there were those people who said, this was presenting a very negative image of America and its role globally. This was obviously it was built in 1982, so the Cold War was still going on, and there was still this kind of battle between capitalism and communism. It was very ideological times, and there were those people who would probably say, well, this was an important thing that America went there. Obviously that would possibly be more of an establishment view, but I think other people would say the real lesson to be learned here is the unnecessary loss of life on an enormous scale. And if you can remember that this is about people, it's about people who lost their lives, then that is the only thing you can possibly do in a memorial. And that is why today this is such an important memorial, because it is about the people. And I think if we do anything when it comes to the coronavirus, I think we have to think that it's got to be about the people who fought this, but also the people who were the victims of it, and also why they were the victims of it, because more and more, as we look into the detail, we're seeing that it is the people who are on the lowest pay who are more likely to get this disease and who are more likely to die from this disease. And also that is, if you are someone from a black and minority ethnic background, you're effectively many times, I think it is 4 times more likely to be in that situation. That's completely unacceptable. And so any kind of legacy we have, any kind of thinking about change and really cementing that change has to embrace this. But the reason I say this is because obviously there's still quite a lot of interesting visuals and other things coming out of this crisis. And one of the big visuals, which actually came from yesterday, from Wednesday, is this video of a bus. I've just it's come from Sky News, and so effectively what this shows is a load of people coming off a bus, and you can see a few people are wearing masks. Yeah, 1 or 2 people aren't wearing masks. This is like a typical kind of rush to get off a London bus. I mean, anyone who's travelled on a London bus, obviously this is totally normal. This is how we get off buses. Obviously it's a bit different because we're now in this coronavirus socially distancing scenario. So, one might think, people should be doing it a bit differently. There should be more space between each person. And maybe every single person should be wearing a mask. That is something that the Mayor of London has recommended. Now, obviously, this is the first day back, or this is, for many people, this will be the first day back after work. But also, I think we need to look at something like this and think of it as a bit of a design problem, because a bus is something that has been designed by people. These don't just grow on trees, right? So someone's put together a bus to work in a certain situation, but that situation has changed. And so we need to think about how we can redesign buses, but also how we get on and off buses to make it work under this new scenario. And this is 100% totally possible. And the design expertise exists, and it exists right here in London. And a lot of it is actually already engaged with Transport for London through its framework, such as the Add Up To framework. So these people are literally just an email or a phone call away. We need to get design in to solve this problem. Now, and I think this is... It comes back to that idea of change, because look, here's a visual I'm showing you, and this is the House of Parliament. So this is how, in the House of Commons, they're sitting right now. And this is a socially distancing arrangement. So you can see there's the front bench with a handful of people on it, and then the second bench on either side, completely empty. And if you look closely, you can see it's fenced off with some sort of tape. And then the third bench, that's a good distance from the front bench, again has a handful of people, and then there's another row of empty benches, and then there's the final row of benches, right? So normally this room would hold about 600 people. That's the more actually the number of MPs, and that's just on this level. There's a higher level with a public gallery, press gallery, etc. And so here in this picture, it looks like it's probably over 30, maybe 40 people, and I don't think anybody would fault this and say that this isn't fully socially distance compliant, and this isn't a kind of healthy and practical way of approaching this within our current constraints. But this is just a simple design process, and I think this picture illustrates it quite well. So this is the Prime Minister attending the Prime Minister questions, and as you can see behind him, so the chamber is laid out in a way where you have these like name cards behind each seat. And so you can simply see that what they've done is they've just put into these name card holders so a red no symbol, basically saying don't sit here, or a green tick. And so it's really clear, it's really simple. It basically just says it's okay to sit here, it's not okay to sit there. And this is just what design is about. It's about making things really, really easy, communicating really clearly, and letting people do and be their very best in any scenario, right? And so if you can do it in the Houses of Parliament, if you do it in the House of Commons, then there's no reason why you cannot do it anywhere else. And to prove the point, here is a picture from South Korea. South Korea is one of the places where it's generally accepted that they're doing a lot better than, at least certainly than here, in dealing with this pandemic. And so this is their metro system. and you can simply see that there are seats you can sit on, and there are seats which just say don't sit on this seat. And so it's easy. People know what they can do and what they can't do. And I think this is just something that we need to think about and we need to embrace. Very, very easy to do. And there's just one other thing I'd add, and also that is that here we have an example of a rapid urban mass rapid transit system using buses. This is in Brazil. It was a pioneering system. It's often cited by architects and urban designers. And effectively what you had is special lanes for the buses, and then these special pods that manage the way that you board and disembark from the bus. And we need to think about this. We need to say, well, look, we need to have a system there at the bus stops and on the street that allow people to get on and off the bus in a way which is compliant with social distancing. It's not impossible, and this public transport system in Brazil is held up around the world as a leading example of how to make effective public transport. I think about 1.3 million people a day use these buses in this city. And again, this is change. Changes are happening, and we can't just say, oh yeah, the changes happen in the Houses of Parliament and they can get it, and then meanwhile the buses aren't changing and the people on the buses are taking unnecessary risk. No, we need even more than any kind of memorial that remembers the names of people who died. We need a lasting legacy of public safety in all of our public spaces, in our cycle paths, in our pavements, in our public transport. We don't want a situation where people are taking unnecessary risk. That's unacceptable. And also, there's no reason why it has to continue in any kind of unsafe way. So those are my thoughts. We'll be back very soon with more interesting topics like this. But do share any comments that you have, and thank you for listening. Good night.